Thanks for watching. We appreciate you. Please subscribe.
Into Abington Hospital's emergency room, Karen Doherty and her team of forensic nurses will take the lead. The forensic nurse examiners take pictures of injuries and collect information and any bodily evidence. They usually get a handful of cases a week. But when COVID struck and stay-at-home orders were put in place, Doherty says victims stopped coming in.
The fear of coming in and being contracted with the virus was a bigger fear than actually living with the violence.
Starting in June, once stay-at-home orders were lifted, the volume of domestic violence patients at Abington increased.
We saw a lot of facial injuries as well, with an increase in strangulation, which we know is one of the deadliest forms of violence.
In total, Doherty says, by her own count, her team saw a 10% increase in domestic abuse cases in the ER. The hospital itself, like most throughout the region, doesn't track domestic violence cases.
It's that dirty little secret that we still want to keep hidden underneath, and as long as it stays underneath, it's going to stay there, right? It's never going to go away.
So even medical professionals are still sort of sweeping it under the rug?
Yeah. There's still a lack of knowledge among medical professionals as well.
For their part, Abington says they have an on-site social worker who also works with victims and keeps her own statistics.
We checked with several hospitals in the region to see if they're tracking domestic violence. Cooper Health in New Jersey says they don't, but Christiana Care, similar to Abington, does. No other hospitals responded.
Christiana Care also has a team of forensic nurses who keep their own stats. Between March and June of this year, Christiana had 34 more domestic violence cases than the same time last year. We requested interviews with the hospital associations in Pennsylvania, New Jersey, and Delaware to discuss best practices in tracking domestic violence. All three declined interviews but sent us emailed statements. The Hospital and Health System Association of Pennsylvania says in part, the hospital community stays abreast of recommendations like that of the American College of Obstetricians and Gynecologists and works in partnership with the State Department of Health on key public health priorities such as intimate partner violence. The New Jersey Hospital Association spokesperson says in part that the state requires domestic homicides to be tracked and reviewed. She also says that New Jersey hospitals are also required to report to state police any injury caused by a firearm or explosive device. But we checked and there isn't a domestic violence subcategory for those reports. The Delaware Healthcare Association says in part, every patient who comes to a Delaware emergency department is screened for domestic violence. Domestic violence victims are then met by a case manager, social worker, forensic, or behavioral health nurse who can offer targeted resources to meet the patient's needs. However, the association says Delaware state law doesn't require hospitals to track those screenings, a point that was echoed by Christiana Care. Sarah McMahon studies domestic violence and is the director of the Center on Violence Against Women and Children at Rutgers University. She says domestic violence screenings should be done beyond the ER.
It's important for us to be able to then tailor and design effective prevention and intervention strategies, and the healthcare setting provides one of those places.
But she points out there has to be a strategy to domestic violence data collection.
Just checking off whether or not someone said yes or no is not actually helpful.
Back at Abington, Doherty says that some domestic abuse may never be counted and tracked.
What happens behind closed doors is just that, behind closed doors, and it often goes unreported and unseen, even by some of your closest friends and family.
For the investigators, I'm Claudia Vargas, NBC 10 News. Count on it.